All right. Hi, everybody. Welcome to the Healthy Steps Managing Diabetes session. I want to thank HealthGap for the opportunity today to be able to bring this Managing Diabetes workshop. Looking forward to it. If you do have questions, we have the chat. And if I don't know if there's like a hand raising option or something like that, but I'll stop here and there for if you have questions. So as to respect everybody's time, I think we should just go ahead and get started. Next slide. My name is Deasa Dorsey. I'm a registered nurse. I'm the founder of ICANN Health LLC and the author of the ICANN manual. I'm a health advocate and a community educator. Next slide. So for today's presentation, we'll reference some pages from the ICANN manual, which will pretty much be all of the graphics that you'll see. Just really quickly, the ICANN manual is a diabetes tool that I've created that assists with creating goals while providing guidance, accountability, insight, and education. So our objectives for today will be to define diabetes and differentiate between the different types of diabetes, identify risk factors and understand the effects of diabetes, and identify ways to manage diabetes. So we'll get started with some data. Next slide. So some statistics. According to the ADA, or the American Diabetes Association, in 2019, 37.3 million Americans had diabetes. There are 1.4 million new cases each year, and approximately 1 million Ohioans have been diagnosed, but that does not account for the undiagnosed amount of people. So basically, there's probably a lot of people that are undiagnosed, but they kind of live in the area of this with the symptoms, and they don't recognize these symptoms. And some people just don't go to the doctor. It's just not something that people, unfortunately, it's not something that people do like annually, like we should. According to the Cincinnati Health Community Assessment in 2017, diabetes was the 5th leading cause of death. And let me just clarify that diabetes itself doesn't directly cause death. Sometimes it's the effects or some of the symptoms of diabetes. All right, next slide. So before looking too deeply at this slide, can anybody share 1 or 2 types of diabetes? You're welcome to come off mute and just share what you know. Don't be shy.
Hi, this is Beatrice. I'm not sure what you asked. I had a hard time getting on, but I'm on now. So what was your question?
I was just saying, do you know any types of diabetes that you could share?
I know that there's type 1 diabetes and type 2. And then I think there is, when my niece got diabetes, she was, I think this was 11 or 14. Okay. Junior diabetes, and it was horrible. Yeah, horrible. That's all I can say. Yeah.
I'm sorry to hear that. But yeah, so you have actually described type 1 when you called it juvenile. So thank you for sharing that. So there's 4 types we'll talk about today. There's diabetes type 1, which is what you described, like I said, as juvenile. They still use those terms, but not as much anymore. Diabetes type 1 is when your body doesn't produce insulin. It's pretty basic definition. And then there's diabetes type 2. Diabetes type 2 is also known as diabetes mellitus, and your body doesn't use the insulin correctly. So it'll produce insulin, but it may not be very sensitive. It might be insulin resistant. Your body might be insulin resistant, or it just doesn't utilize the insulin well enough. It may not produce enough insulin. So there's different types, and we'll talk about those. Then there's gestational diabetes. And that's when a pregnant person develops diabetes or high blood sugar during pregnancy. And the thing about gestational, with gestational diabetes, it may go away after the baby is delivered. So, but I will tell you that it does increase the chances of somebody developing diabetes type 2 later on in life. So gestational diabetes, and then you have pre-diabetes, which we're seeing a lot of numbers in pre-diabetes these days. And I think that's because at one point there was no term for pre-diabetes. It's not necessarily a new idea, but it wasn't always, that wasn't necessarily defined. So pre-diabetes is when your blood sugar is higher than normal, but it's not high enough to be considered full-blown diabetes. So it's like right there on that cusp. So those are the 4 type diabetes: type 1, type 2, gestational, and pre-diabetes. All right. So on the next image here, you'll see a little graphic about diabetes. And let's kind of get a little bit deeper into what happens when somebody has diabetes. So on the left, you'll see non-diabetes. So let's just chat about that. Person eats a sandwich. This is what happens. The person will eat a sandwich. The sandwich goes down to the stomach. The stomach then changes the sandwich into glucose or sugar. Another term for glucose is sugar. Then the sugar or glucose will move into the bloodstream. When that happens, there's a signal that goes off to your pancreas, and the pancreas will say, hey, there's sugar in the bloodstream, I'm going to produce insulin. So the insulin gets produced, and then the sugar and the insulin hold hands and they move into the cell. And from there, the cell has energy. So that's just a really quick overview of what happens with somebody without diabetes. You eat the food goes down to your stomach, the stomach converts the food to sugar, sugar moves into the bloodstream, then the pancreas says, hey, there's sugar in the bloodstream, holds hands, it produces insulin, insulin holds hands with the sugar and it moves into the cell, and then it produces energy. Now, let's talk about what happens with somebody who has diabetes type 1 or type 2. Same idea on the right side. The person will eat the sandwich will go to the stomach will convert the sandwich into glucose or sugar. The sugar moves into the bloodstream, but the signal doesn't go off to the pancreas like normal. So it either doesn't produce any insulin, which will be diabetes type 1, or it just produces very little insulin, or there's poor sensitivity to the insulin. And so then, as you can see, it's not as much insulin. So what happens is the sugar is not able to cross the bloodstream, and it's backed up into the blood, also known as hyperglycemia, or high sugar levels in the blood. And then there's no energy produced. So that's when you hear people say they feel tired or sluggish because there's too much sugar actually left in the bloodstream. So those are just kind of high level, quick visuals of what happens in the body when there's too much sugar in the blood, or somebody with diabetes or not with diabetes. Okay, next slide.
Yes.
So let's chat a little bit about risk factors. Really quickly, we'll go over the risk factors for type 1. There's family history, pancreatic disease, genetics, and I like to add some medications. Some medications can damage the pancreas, which will make the insulin ineffective or not be produced. Risk factors for type 2 diabetes would be obesity, ethnicity, so Native Americans have higher, African Americans, Hispanic, and Asian Americans, high blood pressure, high cholesterol, sedentary lifestyle or not moving enough, family history, and being greater or older than 45 years old. So these are all just risk factors that make us more prone or have higher risk of developing diabetes. So let's talk about obesity really quickly, because that's one of the things that's actually manageable. And the thing about diabetes type 2 is that it actually is manageable, which is why I do appreciate opportunities where we can talk about it, because we have power to be able to help ourselves. Now with diabetes type 1, not as much, because again, that's generally genetic, family history, or pancreatic disease. People are born with it, things like that. So obesity is the leading risk factor for type 2 diabetes, the leading risk factor. The stress of the weight on a cellular level causes the cells to basically turn down or become insulin resistant. So the cells become more resistant to the insulin, which increases the blood sugar in the blood. Increases the sugar in the blood. I'm sorry. Oh, okay, sorry, thought somebody said something. So high blood pressure, another risk factor, is something that is manageable. According to the American Diabetes Association, having diabetes type 2 and high blood pressure increases your chances of having a heart attack or stroke, and increases your chances of developing other diabetes-related diseases such as kidney disease and diabetic retinopathy, which is a condition that happens as a result of damage to the blood vessels in the retina, or the eyes, of people with diabetes. And this could actually lead to blindness. So it can happen when you have a history of uncontrolled high blood sugar levels. There's people that I've worked with that I've heard say, things just get kind of blurry. Well, not only is that a symptom of high blood sugar, if that sustains too long, that you're more at risk for developing retinopathy. High cholesterol, which we are aware that's another risk factor. We have to keep those down. So when we go to the doctor, we talk about our HDL, our LDL, and our triglycerides. So keeping an eye on those things. Sedentary lifestyle, again, something that we can control. So if you're anything like me, when I go to the store, I try to find a spot right in front of the door, whether I'm going to the grocery store or the mall. I'll drive around and look for a close spot. But what I challenge myself sometimes to do, and what I'll challenge you all, is get a few extra steps, maybe park a little further away. Because some people, when they're trying to manage a sedentary lifestyle or not moving enough, they want to, one day they're not, moving enough. The next day say, you know what, I'm going to the gym and I'm going to get on the elliptical, or I'm going to get on the treadmill for a whole hour. And it's like, wait a minute. We have to gradually do some of these activities. We can't just go from literally 0 or 1 to 99 or 100 that quickly. We have to allow our bodies to have a chance to catch up. So making little strides, like parking further away, or in between commercials, getting up and walk around from your bedroom to the bathroom, back to the living room, during commercial breaks, after dinner, taking a short walk. It's starting to get warm. Some of us, we experience in the winter, we kind of get a little down. So it's nice, it's starting to get nice out, go outside for a little bit, take the steps instead of the elevator. Again, I'll be honest, I'll stand at the elevator for 2 extra minutes instead of just walking up the steps, And then also some of us have injuries or, some pain. So, just doing things that work for you, when you create these goals, don't try to do too much, do things that work for you. And again, remember, it's gradual. The American Heart Association recommends 150 minutes per week of moderate intensity exercise. So about 20 minutes over 7 days, or 30 minutes over 5 days. They also, or you can do 75 minutes per week of vigorous exercise. So about 11 minutes over 7 days, or 15 minutes over 5 days. Or you can do a combination of both moderate and vigorous. So just to recap the risk factors, I myself have 2 factors already. Obviously, one, I'm African-American, and my family history. I had to think about the other one. My family history. I'm already in the category of being at risk for diabetes. So some of the things we can't change, but again, the good news is some of the things we can change. So we can work on the weight control, we can monitor our blood pressure, we can move around more. Just those things will keep, help us manage it. Managing diabetes is more than just watching your blood sugar. It's about protecting your whole self and your heart as well. Let's look over at the next image, signs and symptoms. So according to the American Diabetes Association, the average blood sugar is between 70 to 110. So meaning when you check your blood sugar, your average should be the average is 70 to 110. Now, or when your blood sugar is low, hypoglycemia is below 70, but some sources may say 60. Hyperglycemia is when your blood sugar is too high. Some sources may say 125, others may say 140. So basically what I'm trying to tell you is that's something you wanted to determine with your physician, because what's honestly too high or too low for you may not be a problem for somebody else. So let's kind of go over a little bit of the symptoms. So hypoglycemia, or when your blood sugar is too low, you can have sweatiness. You can be sweaty, you can be shaky or dizzy, you can have a headache, a fast or rapid heartbeat, weak, you can be kind of weak or tired, impaired vision, or hungry. These are signs and symptoms of when it's too low. Now, hyperglycemia, or when your blood sugar is too high, you can be hungry, you can be thirsty, fatigued or kind of tired, you can have a headache, blurred vision, or frequent urination. I don't know if you noticed, but some of these symptoms are on both sides. So being hungry could mean it's too high, or it could mean it's too low. Not sure. Having a headache could mean it's too high, or it could be too low. So I'm going to ask you all, and feel free to come off mute. What would you do if your blood sugar, if you're having a headache and you think it might be, a blood sugar issue? How would you determine if it's too high or if it's too low? Feel free to hop off.
Hi, it's Beatrice again. I can't see the slide where they have the red and the blue. We're in front of that one, the hyperglycemia. Mm-hmm. I can't see that slide. But you asked what would we do if we had a headache and we didn't know if we had hypo or hyper?
Exactly. What would you do? How would you determine if you were experiencing a blood sugar that was too high or too low?
I'm not sure. I don't know how you determine that.
Okay, that's fair. Does anybody else have an idea? If you're having a high or low and you're not sure if it's high or low, what would you do to find out?
Take a blood test, check your blood.
There you go. Boom. That's perfect. You check your blood sugar, because say, for instance, you're experiencing a headache or you're feeling weak or tired or fatigued, and you're not sure if your blood sugar is too high or too low. Say, for instance, it's too high and you think it's too low, and you eat candy or you eat something that's going to bring your blood sugar up, and you didn't know it was already high. What just happened? It's going to go higher. Or if it's too low and you're experiencing these things and you're like, oh, I'm not sure if it's too high or too low, but I'm going to take some insulin to make it go low because I think it may be too high. You're not sure. If you take insulin, it's going to go down even lower. So the best thing to do to determine if your blood sugar is too high or too low is to check it. So let me ask you this. If you're experiencing a blood sugar that's too low, does anybody know what they would do?
Drink orange juice.
Something with some sugar. Drink some orange juice or something with some sugar.
Perfect. Good. So I'll share this rule with you. It's called the 15-15 rule. So what it is you eat or drink 15 to 20 grams of fast-acting carbs, or fast-acting is, like you were just saying, orange juice, something that's not like mashed potatoes, not something that's going to take a while to digest and bring your blood sugar up. So you'll eat something fast-acting and then check your blood sugar 15 minutes later. So 15 grams, 15 minutes later. And basically, you're going to keep doing that until it gets up to whatever goal you and your doctor have decided on is a good place for you. So let's just say your blood sugar was down to 60, and that's not good for you. You take 15 grams of a fast acting carb, and then you wait 15 minutes, and then hopefully it's up to 75 and you're in a good range and you're good. If it wasn't, you take 15 more, wait 15 more minutes and check it then and figure, determine. So again, like I said, fast acting is not anything like mashed potatoes or bread. It's something like a glucose tablet, which everybody should be, if you have diabetes, you should have 4 ounces of orange juice, 1 tablespoon of honey, 1 dose of glucose gel, 6 to 7 regular sized jelly beans. These are just examples of fast acting carbs. But the reason I said everybody should have it is because it's important to have it on hand in case your blood sugar gets too low. If you're in the mall and you're walking and you're exercising or whatever you're doing, and you're like, oh, you know what? My blood sugar is starting to feel a little low. Let me check it. Oh no, it's 52. Let me just pull out my jelly beans or whatever I have, my orange juice, whatever you have. It's just good to be prepared in case it gets too low. And having snacks throughout the day helps prevent hypoglycemia. I know most of us eat maybe 1 or 2 to 3 times a day, but when you have diabetes, it's a good idea to just have some snacks throughout the day so that your blood sugar doesn't drop too low. If your blood sugar was too high, then you should rest, have some water, call your physician if you're not taking insulin. If you're taking insulin and you check your blood sugar and it's too high, then you should have what is it called? I can't remember what it's called right now. I'm sorry, it just slipped my head, but you should have basically a guideline. So it's like a range. If your blood sugar is between, I'm just making this up. If its blood sugar is 256 to 300, take 2 units of insulin. If it's 300 to 350, take 3 units. Whatever your sliding scale is what it's called. Whatever your sliding scale is, and people that are taking insulin should know what I'm talking about. That's what you should do if it's too high. If you don't take insulin, again, rest, water, and call your physician if you are concerned or if it's not coming down. All right. Next slide, please. So speaking of your physician, let's talk a little bit about your dream team. This is something I created just to kind of have an idea of people that we should have in our corner that we should be discussing diabetes with. So clinical dream team, people, your clinicians would be your primary care physician, your endocrinologist, your nurse. It could be a care manager, a diabetic nurse, your diabetes educator, your nutritionist or dietitian, and they help you with your meals, your exercise physiologist, your mental health counselor. And I'd like to add, let me go back, mental health counselor. And people are probably like, why that person? That's important because diabetes it's difficult. It's not an easy thing. It's something that takes a lot of energy, a lot of thought, planning, and it could be hard on your mental health. When I used to work with people, one of the first things people would say sometimes when we would be discussing diabetes is they immediately thought about amputation. And not everybody has amputations, but that's something that would play in somebody's head over and over again. And that could really be difficult to deal with, the thought of that. I have had family members that have had to have those things happen. And that could be very scary. So having somebody to talk to discuss your mental health is a really good idea. And I'd like to add an ophthalmologist. An ophthalmologist is also known as the eye doctor. So that's somebody that, again, we're talking about the retinopathy, that would be the person to discuss that with. So that's just the clinical dream team. And these are just some suggestions. At the very least, a primary care physician is somebody that you want to discuss with if you have, talk to if you have diabetes. On the non-clinical dream team, these are people that are supportive and informed, like family members, a spouse, all your encouraging friends, other people that have diabetes companions, accountability partners. These are people that we can just say, hey sis, hey bro, I'm having a bad day, or I really need to go on a walk today. You know, can you hold me accountable, or can you go with me, or things like that. So my goal here is to help people facilitate a team so that you don't feel like you have to manage diabetes on your own, because it can be very challenging. Does anybody have any a supportive team, or anybody they want to share their dream team, or who's on their dream team?
I'll share.
Yeah.
My primary care physician, my ophthalmologist, and the Blue Cross Blue Shield, they have a diabetes support team.
Okay.
And a nurse that will call and check in to see how things are going. So, and a nutritionist.
Wow, that's awesome. And so you said that was the Blue Cross Blue Shield?
Yes.
Okay.
Yes.
And
yes, they have it's a really great program for anyone who has diabetes. They make sure to extend themselves to offer their assistance for healthy eating, monitoring your health condition, and just checking in mental health to see how you're doing as well.
That's awesome. Thank you for sharing that. And anybody else who has Blue Cross Blue Shield, that might be a good, resource. Anybody else want to share? No? Okay. Next slide. All right, so we won't spend a lot of time on this, but I wanted to just at least cover the topic of insulin, because it's important to know where to give your shots. And some of us use insulin to manage diabetes, which is fine. But it's very, very important to know where to give your shots. Again, when I worked with some of my patients in the past, there were what I call veteran diabetics, so people who have had diabetes for a while. And in talking with them, I discovered that they did not quite know where to give their shots, which is why they were seeing me in the first place, because I worked with people who had uncontrolled diabetes. And they're like, I'm giving my insulin, I'm trying to eat right, I'm doing it. But their blood sugars were still high. Well, then it was my job to figure out, well, why are they still high? So when, they're coming in telling me where they're giving insulin, I'm like, bingo, that's why. It's because you're giving insulin in the wrong place. So guess what's happening? The insulin is ineffective, not only ineffective, but dangerous. So it's very important to know where to give insulin. So a few places that we can give insulin injections are in the abdomen or stomach, your upper arm. If your doctor has told you other places that is safe for you, then that's fine. But I'm just sharing some of the most known, some of the most general places that we encourage. Again, the abdomen or the stomach, the upper arm, in your butt, in the front or the side of your thigh. The goal is to inject the insulin in a fatty area, not your muscle and not your bone. So that is important. Not the muscle, not the bone, but you need some fat. So a healthy area where you can grab it and then give your insulin injection there. I like the stomach. That's just one of my favorite places to encourage is in the abdomen, because it's when you're doing it yourself, and you can't, I'm demonstrating, but you can't see what I'm doing. So I keep looking down, I apologize. But when you're giving it yourself, it's an easy place to be able to grab, see clearly, and just go straight in. So do not inject insulin in areas where you have wounds or bruising. So be sure to change the areas often so that you don't create sore areas. Because when you have this bruising, then again, the insulin's not going, it's not being absorbed effectively. It may just stop right at that location. So then you're like, well, I just gave myself insulin, why my blood sugar still high? Well, because it's not being absorbed well. If you are unsure where or how to inject insulin, no matter how long you've had diabetes, there's no shame. Please, please, please talk with your physician or your diabetic educator or anybody else maybe on your clinical dream team. It could be dangerous, like I said, to put in the wrong place. So next slide, please. All right, so goals. I'm sorry, I kind of forgot where I was here. So when you meet with your dietitian or diabetes educator, you'll make some goals that are specific to you. Again, diabetes, we have a lot of, organizations and things like that. and there's a lot of numbers and a lot of things out there, but honestly, diabetes is specific to you, because again, what may be good for one person may not work very well for you. So you want to discuss your blood glucose goals. Like we talked about, the average blood sugar 70 to 110 may not be so for you. So everybody's goals aren't the same. That's something specific. Some people live in a higher area of numbers. So like 79, which may be normal, quote unquote, for one person, may be too low for somebody else. So you want to go over your blood glucose goals and be very clear, you know what's good for you. You want to talk about what foods that'll help you manage diabetes. We all have preferences. And sometimes when I work with different, let's just say demographics, different populations, and especially in different locations, we have different preferences. Some cultures have different preferences. So for instance, I'm not avocado toast and or, different types of cheeses or different things like the cottage cheese. Those aren't going to be things that I'll gravitate toward. So when I'm talking to a nutritionist, I want to let them know things that I like, and I will be open to trying new things, but they can't just try to give me things that, I've never eaten before, and all of a sudden think that I'm going to switch over and begin all these different types of foods. It's a gradual thing. So it's good to talk with somebody, again, like a nutritionist, diabetic educator, dietitian, to discuss exploring options that'll be good for us when trying to make these changes. So if we know we like pizza, we should discuss ways that we can still enjoy it while having diabetes. We might have to make some changes. It could be different crust. We could try different sauces. Maybe we change up the toppings, more veggies, whatever it is. For me, like I said, I come from a family, I don't cook very much, if I'm honest, but they cook soul food. My grandmother, my mom, my aunts, all of them. So we eat some fried chicken, greens, mac and cheese, those types of foods. So for me, going someplace and talking to a nutritionist and they say, changing or completely removing those things from my diet, it won't feel good to me. So, but I can discuss an alternative or different ways to prepare the dishes. So instead of frying the chicken, maybe we talk about baking it, or we use a different type of oil. Instead of using pork in the greens, maybe we use turkey options, or even, if you know how to season them pretty well, sometimes you don't even need meat in your greens. So maybe swap out some of the ingredients in the macaroni and cheese. So basically my goal here is just to express exploring your options and not just stripping yourself of everything that you enjoy, because that could be very difficult. But we make gradual changes and we make substitutions and alternatives so that we can still enjoy foods. Again, in certain cultures, food is what brings people together. Food feels good. We like seasonings and certain, different things like that. So just being mindful not to just completely change everything and do it gradually. So that you can actually adhere. It actually increases the chances that you'll stick to the changes that you make also. So yeah, adjusting meals with exercise, talking about sick days, those are important things to discuss. I don't know if you've been able to read the graphic, to discuss with your dietitian or diabetic educator. All right, you can go to the next slide. So doctor visits. One of the things I like to do is prepare my clients or my patients with information before they have a doctor visit. Even as a nurse, if the doctor tells me I have something or they tell me something new, I don't want them to talk to me like a nurse. I want you to talk to me like a regular person, because, when you're in that situation, sometimes too much information could be overwhelming, or it could just be, it's too much to try to remember. I can't write everything down. Again, you might have just told me I have, bronchitis and now I'm all, nervous, whatever the case. So I do like to prepare people when they go to the doctor to have a conversation so that you could be part of the conversation as well. So some of the suggestions that I have and the recommendations, I even have my patients take, again, these pictures that you're seeing are from a manual. So I encourage my patients, take the manual with you so that you can review the list of things with your doctor. Some of the things the doctor is going to want to cover are they want to update your medication. And I'm sure you've seen that. They always ask you, so are you still taking this? Are you still taking that? Are you still taking 4 or 5 milligrams, 20 milligrams, whatever? So knowing your medication is important. They're going to want to check your weight and maybe your body mass index or BMI. They'll want to set goals with you about that. They'll want to check your your blood pressure, and your pulse, which are also known as vitals. You should check your vitals. They probably want to do an eye check, or discuss any changes with your vision. And again, this is for people with diabetes, but honestly, this is with people, period.
Thank you.
So they'll want to do a heart and lungs. They'll listen to your heart and lungs. They'll want to check your feet. So you'll want to remove your shoes and socks. That's very important, a foot check. And let's talk about that for a second. So feet check reduce the chances of developing serious foot problems related to nerve damage. Diabetes can cause nerve damage and it decreases the circulation. The nerve damage will decrease the circulation. And you may have heard of this term, but the nerve damage is also known as neuropathy, which can make you unaware of pain. And you could have open sores and they won't heal, or they're slow to heal and you don't even know. So taking your shoes and socks off is very important when you have diabetes, when you go to the doctors. These sores can lead to other issues and cause more serious problems. So again, neuropathy, neuropathy is when you kind of have like the numbness or tingling in your feet. And again, that's because of poor circulation. So foot check is very important. A skin check, sometimes you might have sores that aren't healing well. And that's because of, it could be because of nerve damage or whatever the case. So just doing a simple skin check is important. We just talked about neuropathy. It could be burning pain. It could be, like I said, numbness or tingling. They'll want to do blood tests, your glucose or sugar, your A1C, which is something they'll want to do every 3 months. And I encourage to get that updated and checked so you can kind of see how your blood sugars are doing. They'll want to check your lipids or your cholesterol, and different things like that. Your urine, they might want to check ketones to see if if you're having sugar in your urine, which your blood sugar is too high. Different things like that. So there's other preventative screenings. Excuse me. But again, this is just things I like to share with people when they go to the doctor for a couple reasons, but also because maybe you go to the doctor and doctor just checks your lungs and heart. And then they say, okay, you sound good. You're good to go. And you're like, if you don't know, you're just like, okay, good. My doctor said I'm good to go. But how we advocate for ourselves. And I like to consider myself an advocate. We advocate for ourselves by saying, hey, I know I have diabetes. I know these things should be checked, or I want to know, how's my weight? I'm having some vision issues. You didn't even ask about my vision. You didn't ask to check my feet. So now you're empowered to know, I need these things checked because I'm in control. Basically, at the end of the day, nobody can do your body any better than you, and you know your body best. So you have to take control of the situation if your doctor may not be doing, these things for you. And at that point, I would say you might want to consider a different physician as well. But sometimes, there's a scripture that talks, I think, the people perish because of lack of knowledge. We have to know, we have to be informed. So again, those are just some things. And again, if later, or maybe the health gap can reach out and we can figure out how to get a manual to you if you would like this information. Again, it's all in the manual. Next slide, please. All right. So stress. This is something that we don't think about enough when talking about diabetes. Stress directly affects diabetes and other things. There's hormones from stress that increase your blood pressure, raise your heart rate, and can cause your blood sugar to rise too. Just having sustained stress. It's one thing where your kids are driving you nuts, you know, that's 15, 20, maybe even an hour, and you're like, okay, I need to step away. But it also sustains stress. So stress every day for long periods of time, over time, it causes a wear and tear to your body. In fact, stress can be linked back, or a lot of diseases can be linked back to stress. Our bodies aren't meant to sustain stress at high levels for a long period of time. A big way to manage diabetes is to manage stress. So does anybody have any stress relieving strategies that they like to share? What are some things you do to manage your stress?
This is Beatrice. I breathe. It's called mindfulness. And you just take 60 seconds and eyes are closed, brain is shut down, and you exhale and inhale. And it's 10 times. And my rate goes down from maybe 80 to 52 or 58. I've checked it, so I know.
Absolutely. Actually, breathing techniques is one of the easiest things you can do to help calm and relax your body. So that's awesome. Meditation or prayer, which is kind of like your breathing technique, meditation. Aerobic exercise, like climbing the stairs, treadmill, swimming, jogging, walking. These are all good stress management strategies. Yoga, deep breathing, like Miss Beatrice was saying, massage therapy. Go ahead and schedule your massage for once or twice a month. You deserve it. Music therapy, just maybe dim the lights and turn on something soothing. Journaling, people journal daily. You kind of get it all out. Instead of holding everything in, taking breaks is important. You know, if we sit in front of a computer all day, depending on what kind of work you do, stepping away from the computer, just take a break or set your alarm to go off every however often, every hour, to just get up, walk around for a little bit, come back, and then sit back down, do some work, another hour, get up, walk, sleep. Sleep is a stress relief. And your body tells you when it's tired. Listen, when I was in college, I felt like it wasn't time for sleep. My body would be telling me it's sleep, and I'm like, no, I'm pushing on, and it's like you go against what's natural. So sleep is really important. And support groups really help manage stress, because you're able to chat with people that are going through what you're going through, and you can relate. And then also people can help you, with strategies like we're doing now, sharing with each other what works for you. So again, those are some stress management strategies. Slowing down, even for 5 minutes, you slow down your emotions, you respond better to small things don't affect you as much. I don't know if anybody notices when you feel stressed, you're very reactionary. It's like, you get, for me, like if I'm stressed, somebody say the wrong thing, it could have been no other issues. And all of a sudden I'm just like, boom, and I just explode. And it's like, I apologize. It's not that you've done anything. It's just I'm stressed and I'm reacting very quickly. So decreasing stress hormones in your body will increase your overall health. And just overall, doesn't it feel good to feel good? The more relaxed you feel, the clearer, more present you are. So I just challenge everybody to slow down a little bit sometimes, or do things again that will help eliminate some of the stress. And again, that will help with your blood pressure. Stress will help with, I don't know if you notice that when you're stressed, your body holds stress as well. So pain, some of our pain is related to stress. Again, massages help, and it helps loosen you up, reduce some of that. So again, just slowing down and paying attention to your body will help you with stress management. Next slide. I wanted to do a quick stress management activity, but for the sake of time, I'm going to hold off. But basically, we were just going to slow down for about 2 minutes and take some breaths, and then, do some visualization. But we're not going to be able to do that right now. So I do apologize, just like I said, for the sake of time. All right. So next slide, please. Let's just recap some things to do for managing diabetes. We have check your blood sugar frequently and log it. We didn't talk about logging, but logging just helps you see over time. So if you check it, say for instance, you check your blood sugar twice a day, in the morning and 2 hours after you eat. Now you can see on, Monday I was doing real good. But Tuesday I kind of slipped because I ate, mashed potatoes and a piece of bread. And so my blood sugar went up a little bit 2 hours after. But basically my point is logging helps you see your trends and helps you make improvements where necessary. Take your medication the way it's prescribed. That is a big one. Some of us either don't like to take our medication at all, or we don't take it the way the doctor has prescribed us to take it. So being on top of that will help manage your diabetes. Some people take metformin. Take it the way the doctor is encouraging you. And if it doesn't work for you, tell your doctor. Instead of just stop taking it, sometimes metformin can make people nauseous. And I know people that'll be like, you know what, I'm not taking that stuff. It makes me nauseous. No, let's not do that. Let's talk to the doctor about it or the nurse about it. And then we figure out ways. Maybe we eat, before we take it or after we take it, or some will figure it out together, but don't just not take it. Let's talk about it first. Exercise definitely helps with managing diabetes. Being aware of what you're eating, what's going in your mouth, seeing your dream team regularly, pampering yourself with healthy stress management strategies, reviewing your progress and celebrating your goals, encouraging yourself, saying, hey, this week I did a good job. Maybe you don't reward yourself with food, or maybe you do. Maybe you say, I'm going to go get a very small cup of ice cream just to say good job, whatever's healthy and good for you, because some people can't just stop at that little cup. So maybe they don't even need to start with the little cup. Maybe we celebrate in a different way, go to the movies or something. But make sure you celebrate yourself for your accomplishments. And meal prep, that's a good option for some people. If you got a really, really busy week, maybe you meal prep for a couple of days or for the week so that you won't go to McDonald's or Wendy's. You'll say, you know what, I already got something, stick it in the microwave or stick it in the oven, boom, 10 minutes, it's warmed up and I'm good. And encourage yourself and have grace with yourself. And what I mean by that is making sure you recognize that this can be difficult. Diabetes, again, it's not an easy thing to deal with. So make sure you're giving yourself grace. So when you are stressed and when you don't have the greatest day, not feeling totally defeated and knowing that, hey, every day is not going to be a great day and that's okay, but I'm going to get back up tomorrow and I'm going to start all over because I have the opportunity to do that. So I do want to encourage you all that it can be done. You can do this. You can manage diabetes and you can prevent diabetes and you can be successful, but just make sure that you know that as well. Next slide, please. These are just options for creating a journal. So like if you have your A1C chart, that's one thing I tell people. If you're checking your A1C every 3 months, maybe you create a journal. So January, you checked it. And then March, you checked it. So just writing down the number. So if January, your A1C was 5.7, that's pretty good. And then you checked it again in March, you're 6.2. Make sure you're paying attention because it's going up. And then you check it 3 months later and 3 months later. So so that way, again, you can see your trends, your medication. So these are just examples of goals. Sorry, not of goals, of journal prompts to create a journal. Next slide, please. Again, this is just all the pages were from the manual. Next slide, please. And if you like to get in contact with me, really quick, Miss Ethel, looks like you have a question. Just want to know if honey is a good substitution for sugar in recipes. Honey can be a good substitute. Also, agave is a good substitute. There's stevia. There's just natural things, like you can just put maybe some fruit in there and whatever you're using, or sometimes yogurt. So they're, kind of thinking like that too. But yeah, honey does have, it's kind of one of those things you can take to get your blood pressure up your blood sugar up. So kind of be careful with honey because it does make your blood sugar go up quickly. But I think Miss Daphne jumped on. She might be able to give some other alternatives as well. But yes, you can use honey. Again, we're at 6:50, so I want to be mindful. My name is Deasa. I can be reached by phone, email. My website is icanhealthllc.com. I want to thank Health Gap again for having me. And yeah, I'll turn it over to you all unless somebody has a question. Oh.
Hi, everyone. If you can look into the chat, there is a survey that we are going to do. If you complete the survey, you do get an incentive if you were one of the first 20 people that arrived on the call. So go ahead and complete that survey. Durant's posted it in the chat. So if you just look for it in the chat under Durant's. And then when you're done with the survey, just type done in the comments. In the meantime, I'd like to go ahead and bring up Miss Daphne Baines.
Hello, everyone. I know you're kind of busy doing some things, but I want to take this time to introduce myself and introduce you to something great the Health Gap is going to start. I would like to see everyone here. Let's see here, full screen. Okay. Well, my name is Daphne Baines, and I am a coach. I'm a life coach, I'm a health coach. I teach diabetes prevention and management. I am definitely a colleague of Miss Deasa here. She's a wonderful presenter, and I'm so sorry I couldn't catch the whole webinar. But Deasa's book, I Can Manual, is very informative. If you don't have one, try to make sure you get one, especially those with diabetes, because it is very, very, very useful. So Deasa talked about diabetes and how you can control it and prevent it. I want to talk about something that the Health Gap will be doing. We are going to start a support group. We have a kickoff to the support group on March 31st from 6 to 7. I will be your webinar host. And I want you all to come to this celebration. It is like, come on, we're going to party together. And so come on and have some fun on the 31st. Learn all about what support groups are all about, how you can get some benefits out of it. And the purpose of the support group is to help you, to be with you while you are managing your diabetes. I know there may be some on here who are trying to prevent getting diabetes because they're pre-diabetic. We want to address all of those issues you may have. The issue about honey, can you use honey as a substitute? Those are things we'll be talking about at the support group. And yes, you can use honey as a substitute, but a very little bit. Like Deasa said, honey does spike your sugar up, so you want to be careful with using that and perhaps use other alternatives. But those are the types of things we will discuss at the support group. The support group is a way for you to come together with other people who are trying to do the same thing that you're trying to do. If you want to lose a little weight, we're going to talk about that. If you want to learn how to eat proper portion that Deasa talked about, we're going to talk more about that, and we're going to have some challenges. We're going to make sure you learn something, but not just learn something. We definitely want to challenge you to do something and then be accountable. That's what we're all about. And so it's a place of love, safety, a place of knowledge, and a place where you can grow. So I hope to see you on March 31st for our support group kickoff. The dates of the support group are April the 7th through June the 23rd. We'll be meeting on Thursdays at 6 p.m., 6 to 7, and we will be doing it in person at the Health Gap. So please, please, please sign up for this webinar. more information will be sent out, and you can get in touch with the Health Gap if you have any questions. Thank you, guys. I hope to see you all. Please come and be part of it. Deasa, great job.